I'd like to welcome everybody to our Go Virginia, Retooling Virginia Manufacturers for Strategic Industries Lunch and Learn. So thank you for joining us today. We're going to go through a few things. I'm going to speak a little bit briefly and kind of then turn it over to the folks who really know what's going on. My name is Dean Young. I'm the Vice President of Industrial Development for GENEDGE. So I work with our field organization, our regional growth managers, and our marketing department as part of my role within GENEDGE. I'm going to give a little bit of a program overview as we go through this, and then I'm going to turn it over to Kelly Parker from VHHA. She's going to give a little bit of an update on some research and some information that they've gathered for us in terms of what the PPE medical device, medical industry market is going to look like going forward. I'm going to then turn it over to Brett Vassey, President of VMA, who's going to give us some additional information about opportunities and in particular look at potentially what some of the workforce challenges might be as well. Cheryl Carrico, who is our program manager, will kind of close us out then with what are the next steps for the program. And we'll take questions for any of those folks as we go. So we can take some questions at the end of each section if you like, as well as questions at the end. If you do have questions, you could put them into the chat. I'll try to keep up with them. I'll try to moderate as we go. For those of you who aren't familiar with GENEDGE and who we are, GENEDGE is a political subdivision of the Commonwealth of Virginia. So we are a public resource here to help manufacturing, engineering, and technology businesses in the Commonwealth innovate, compete, and grow. So our job is really an economic development role. We are affiliated as well with a federal program through the Department of Commerce, funded through NIST, the National Institute of Standards and Technology, called the Manufacturing Extension Partnership Program, or NIST MEP. We have been that representative for that program in the state since 1994. So we have kind of a role there to help provide technology transfer and consulting services primarily to those companies that we serve to help them become more competitive, really to help drive growth within the Commonwealth for those industries. We have about 30 direct employees, but we primarily work through an extensive network of high quality third-party providers as well, most of them small businesses within the Commonwealth. So we walk and talk like consultants. We do consulting kind of work, but at the end of the day, we're really focused on trying to drive economic development within the Commonwealth, primarily within the existing businesses that make up the manufacturing sector in the state. I'm going to give a little bit of an overview of this program. I'm going to go relatively quickly so we have more time for the folks on the program to speak, but one of the things I think everybody is acutely aware of is that this pandemic has really highlighted some supply chain challenges that exist primarily, we're talking right now within the PPE, medical device, medical industry kind of world, primarily because of an over-reliance on imported products. So when you end up with supply chains that are overly reliant on particular geographic areas or different parts of the world, and then those supply from those parts of the world are cut off, it can have a big risk, or it can introduce a huge risk or a huge crisis in the supply chain. And we experienced that with medical device PPE throughout the pandemic. So I think the need it has been initially represented by the PPE world. We called it, I think in one of the white papers we wrote, a canary in the coal mine. It shows what can happen when you're overly reliant on imported products. Of course, the opportunity is not just for PPE, but also for other industries as well that have similar risks. We started as part of our response to the pandemic, working with Go Virginia Region 1. So for those of you who are familiar with the Go Virginia structure within the state, Region 1, we originally reached out looking at potentially doing a regional program. And as we looked at it, we thought, well, this is something that probably makes sense and is relevant to the entire state. As part of that NIST MEP network, we had received some funding through the CARES Act that allowed us to help respond to the pandemic and primarily help those manufacturing companies that had been hurt by it. And so we ended up putting that funding together as match, going to the Go Virginia State Board with the assistance and the leadership of Go Virginia Region 1, and put in a grant application at the state level to access some of their funding. And we're successful in getting a total of about $4.5 million for this program spread over 2 years. So our goals for this are really to help companies enter and profitably serve some new markets, focusing primarily in the first year on PPE, but later in other verticals or other industries as well that may have similar challenges, or even maybe in some cases even bigger risks that haven't materialized yet, but are certainly there and provide some concern when it comes to things like national security. So we're going to help also try to help healthcare providers diversify their sourcing for PPE. Again, trying to reduce the amount of risk that exists to having more reliable supply, and primarily building that supply capacity within the Commonwealth so that we can respond not only to Virginia's needs, but to the rest of the nation's needs as well. We've set this up as a 2-year program. We do have some metrics, of course, so we expect to try to help 50 companies over the 2-year period, 25 the first year, 25 the second year, in being successful in trying to generate new commercial opportunities, which means really becoming sustainable in those areas to generate revenue that ultimately will drive jobs or retain jobs that may have been lost by their loss of revenues in their existing industries. We're hoping to drive a significant amount of revenue from that new product capacity as well as investment. And again, the goal here is not to take advantage and necessarily in the short term on those initial kind of emergency use authorization type opportunities that exist today, but to really kind of transition and pivot into doing this in a sustainable way so that there is long-term kind of return to the Commonwealth for that investment that we're putting in. From a statewide perspective and an organizational perspective, the program is governed by an advisory committee. So as I said earlier, we're a political subdivision of the Commonwealth. We have a board of trustees that oversees our operations. We've stood up this advisory committee as a subcommittee to our board. So there are 3 of our board members, one of whom is the chairman. Rick, I think, may be on with us today, Rick Galliano. He is serving as the chairman of that advisory committee, along with representatives from each of the Go Virginia regions in the state. So one of the cool things about this program is that when we started working on it with Region 1, all 9 planning regions of the Go Virginia structure signed on and endorsed the program. And so each of them have a representative on our advisory committee, along with some of the partnering organizations that you see here, VHHA and VMA. The 2 folks that are going to talk to you today are also members of that advisory committee and are going to help us shape kind of where we're headed with that program. And I'll talk a little bit more about kind of where we're headed second year in just a second. But Dr. Cheryl Carrico has been brought on as our program manager. So she is actually the connecting tissue, if you will, that makes all of this work, working with our regional growth managers that are spread across the state to try to help engage companies that are interested in pivoting, that are aligned with the goals of this program, so that we can help them kind of understand what those opportunities are, and then how do they actually take advantage of them through the provision of services. So as I said earlier, it's about a $4.5 million program, primarily based in service offerings. Cheryl will talk on a little bit more detail at the end about what those kinds of things are and where we're headed with the program and how to get into the program, and kind of more in detail what the steps are of the program. But primarily what we're trying to do here is to understand where they can pivot to, what those opportunities look like, really understand what the competitive space is in those areas, and then help them understand what they've got to do to commercialize or to retool and commercialize in that area. It is a 2-year program. The first year we're focused primarily on medical device PPE kind of products. So we expect to get 25 companies in the first year through that industry, building capacity for those types of products and to support the healthcare industry and others, and primarily in response to the pandemic. Within the second year, we're going to shift to other verticals. So the goal would be to identify other vertical industries or other segments that make sense for Virginia, where we have strength, we have an existing capacity, where we can build the capacity to supply those, and where we can ultimately end up with clusters of activity that make sense so that we can target at-risk industries that are necessary for our national security or to maintain our economy, but do that in a way where we can build that capacity and be known for that within Virginia, ultimately to be able to use it both as an existing growth engine and an attraction mechanism for companies that may want to locate back to the U.S. If they're aligned with those industries, makes it a nice target for them to want to look at Virginia because we already have capability or capacity in those areas. So we will be figuring that out kind of in the February-ish time frame. The advisory committee will make those decisions on where we target, and then we'll go through another round very similar to what we're doing this year with the first round focused on PPE. So before I go any further, I can stop there and see, do we have any questions in the chat? Question, will the slides be available following the call? Yes, they will. We'll make the materials available. And as I said, we will record this and it will be available as well, so that you can share it with others if you find this interesting and somebody might find it beneficial to watch. So without further ado, I'm going to turn it over to Kelly Parker, and she's going to give us a little bit of an update on some of the work that they've done, the research that they've done. Kelly is the Director of Emergency Preparedness for VHHA. So she really is leading their COVID-19 response, and she's helping their members bridge the gap between the private and public sector areas of the response. She's a graduate of George Mason University, has a graduate of the VCU as well, where she's got her MBA degree from. And we've been working very closely with her and her folks since we've kind of started this program, and they've been great and have great information to share. So I'm going to turn it over to Kelly. Kelly?
Great,
should be
thank
good
you,
to share.
team.
I'll stop sharing and you can share. We should be good to go.
Thank you so much. Give me 1 second. Let me make sure I can share this appropriately. Are you able to see the PowerPoint? I see Cheryl shaking her head. Great.
Yep,
awesome. Thank you. Good afternoon, everyone. As Dean said, my name is Kelly Parker. I'm with the Virginia Hospital and Healthcare Association. And I will say it's kind of a nice breath of fresh air to talk about PPE again, because for the last few weeks we've been inundated with vaccination planning efforts. And so I'm kind of liking the break right now in terms of talking about vaccine planning and switching gears again to what is still a challenge for the healthcare industry, which is PPE. So as Dean alluded to early on, in the partnership with GENEDGE and Go Virginia, we began discussions on how we could help kind of show the needs for PPE and really identify and understand where some of the opportunities are for Virginia-based manufacturers. And so we've worked to create a pretty in-depth market opportunities PPE report for the Commonwealth, not only from the healthcare side, but also for the manufacturer side, that really analyzes 3 different areas of the market. It analyzes projected demand for PPE that is necessary to protect healthcare workers from COVID-19. It looks at competitive advantages for current manufacturers within the Commonwealth, and then it looks at the overall opportunities and market for the specific types of PPE that we're going to be talking about today. Let's see if I can. So just to show a little bit, obviously we're with VHHA. We do have Dave Jenkins, and I believe I saw Chris Davis on the meeting as well. They are with our shared services affiliate of VHHA, who we've partnered really closely with to kind of help us navigate the manufacturing and supply chain challenges that we've had throughout COVID-19. And then we brought in Camoin and Associates to really help us with some of the market research for the report. We focused on the healthcare perspective since we've got the relationships with the healthcare sectors in Virginia, and then Camoin really helped us with some of the national and world market research that you'll see. So I think we all know that, the global demand for PPE has really increased since COVID-19. Majority of people probably didn't know what an N95 is or was in January of 2020, and now it's pretty much a commonly used term in every household. And so we saw the rapid kind of increase in terms of PPE in the healthcare sector at the beginning of the pandemic. These were driven primarily by, fear, by CDC recommendations in terms of what was necessary to be used to fight COVID-19. And then just continually driven not only in obviously the US, but across the world. And so we saw significant challenges early on. N95s in particular are not something that are commonly used on a day-to-day basis widespread in the healthcare industry. They're used in very specific settings in healthcare industry in highly infectious areas. So while our hospitals use N95s in maybe very small quantities typically, we then saw N95s were considered the standard for all healthcare providers. And when we rely on what we call just-in-time inventory for some of these supplies that are not traditionally a day-to-day use, widespread use PPE type, we really saw the constraints on the current manufacturers to be able to produce the need that is now required for some of the for the entire healthcare sector. One of the things that we did note in our research is that of the entire PPE market, healthcare only represents about 17.5% of that market. So when we talk about PPE and the manufacturing of PPE, there are varying levels of PPE necessary for healthcare, but there are also other areas and other industries such as manufacturing, oil and gas, construction that use a significant amount of PPE that isn't traditionally the same type of PPE you see in healthcare. So the demand for PPE isn't just in healthcare, it's also in a significant and other industries as well. And now from a mask perspective, pretty much commonly used in every household. So for the purposes of this report and for our work this first year with GENEDGE, we really looked at the PPE that was required or considered required or best practices by the CDC for healthcare workers to protect against COVID-19. And so the report dives into the varying levels of PPE that we're going to discuss. We talk about face masks and shields, N95 respirators, a higher level of respirator, which we call P100s, and PAPRs, which are typically they're not frequently used in healthcare, but they are an elevated level of protection above an N95. We then look at medical gowns, surgical isolation gowns, and coveralls, gloves, which is probably our biggest challenge and will be for a significant amount of time. And then a couple of other products that are used in the healthcare industry. Obviously, hand sanitizer became in short demand or in high demand early on, and we had short supply, but then also some very specific germicidal disposable wipes that are used in the healthcare setting. And so these are the items that we focused on that you'll see in the full report. So to help kind of understand where the challenges are, this has been a bit of an ebb and a flow throughout the duration of the COVID-19 response. We surveyed all of our members. And when we talk about members at the VHHA perspective, we're talking about all of the hospitals and health systems. So this would be every acute care hospital within Virginia, as well as some of the psychiatric and rehabilitation hospitals. And then through my work in emergency preparedness, we also have really close contacts with our long-term care providers, dialysis, et cetera. And so we surveyed our VHHA members, which all of our hospitals and health systems, to really gauge what the difficulty was in obtaining these type of PPE necessary for COVID-19 response. And we asked them to rate on a scale of 1 to 5 the difficulty in obtaining each of these supplies. Now, I do want to note that this survey was conducted in around September. So this was, many months into the COVID-19 response. We had seen some areas of the supply chain open up. Some folks were able to retool. Hand sanitizer was relatively easy to come across, even if it smelled a little bit like vodka or tequila, depending on where it was being made. And we did see, face shields and some just generic basic like surgical masks were becoming more widely available. But if you look on the left-hand side of this screen, the top 3 items, which I would still say are the most difficult to obtain, are going to be the PAPRs, the N95s, and the gloves. And primarily the reason for that is because raw materials and the difficulty to retool manufacturing to produce those is significantly more challenging than some of the other items we're talking about. So along with the identification of the difficulty to obtain different supplies, we also asked our members to help us identify where the challenges are in pricing. We obviously saw pricing skyrocket at the beginning and still is for certain supplies. And there are a number of reasons for this: demand, supply. US-based manufacturing is more expensive than why we get manufacturing done in China. And so to cover costs, what we're traditionally used to paying for price in the US is based off of manufacturing in other countries, and manufacturing in Virginia comes at a bit of a higher price, or in the US. So you can see here we did pre-COVID average costs of all of these supplies, and then we did a post-COVID average costs. And these do flex up and down a little bit, but they've remained relatively consistent. And you can see that we saw an increase in cost in all of the supplies that we were talking about, anywhere from 4% up to 321% increase in cost, specifically for coveralls of all things. And so one of the things we talk about a lot when we're talking about retooling is not only do we need to be competitive on price, but one area where Virginia and US-based manufacturers can really make a difference is on quality. So looking at future demand for PPE in the healthcare setting is really interesting. We're going to have COVID-related demand, which we anticipate to continue through 2021 and potentially beyond. It has increased the demand for PPE across all user types, across all healthcare settings, and it requires a higher level of PPE that has not traditionally been used. We're also going to have the ongoing threat of pandemics and other infectious diseases. If we just look back 20 years, and this is kind of where my role in preparedness comes in, we've seen the kind of rapid increase in these new viruses that we have to respond to. We had SARS in 2002. We had the H1N1 wasn't classified as a pandemic, but potentially could have been in 2009, 2010, which would increase demand. In 2014, 2015, we saw Ebola, which luckily we didn't see too much of Ebola in Virginia. However, that placed a significant strain on the PPE industry then. And then we saw Zika, which was more of a public health threat. And now we have COVID-19. And so I don't think that there's anybody in the preparedness world that unfortunately thinks that these type of new, novel, and increased threats of pandemics and other viruses is going to slow down. And then we have other healthcare demand factors. So we are becoming a larger population in the US. The population is growing across the world. Our need for healthcare services is increasing with an increased population, and also an increased elder population increases the need for more healthcare. So just general healthcare demand overall is continuing to rise. And then kind of circling back to what I mentioned earlier, whereas healthcare is only roughly 17.5% of the PPE industry, there are still the non-healthcare demand factors in other industries such as manufacturing, construction, et cetera, which will continue to use PPE and need increased levels of PPE. So one of the most challenging things that I work in healthcare, and sometimes I even think I need to try to figure out, is the complexities of the healthcare industry. You see one hospital, you see one hospital, you see one nursing home, you see one nursing home. And so we really have to try to identify where the gaps are in terms of the different provider types that we support. So we talk about independent small hospitals, which there are very few of them left in Virginia, but in other states there are still significant independent hospitals, all the way up to large integrated health systems, which we have a majority of here in the Commonwealth, if we're talking about an Inova and Centera, who are really major players in the healthcare industry. And they aren't just hospital based. They have outpatient clinics, they have ambulatory surgery centers, they have private providers, et cetera. So they really are large integrated health systems. And then we talk about long-term care facilities and assisted living facilities who arguably, not even arguably, have the most vulnerable population as it relates to COVID-19, but aren't traditionally ones that are in the need for PPE. And so we look at those facilities, and then we have all your small independent practices, your dentists, your optometrists, your primary care physicians, as well as home health and hospice agencies who might not be are already part of the existing PPE supply chain, which has made it really, really difficult to obtain PPE for some of those suppliers. From one of the major players, or the major player in healthcare supply chain, are what we call GPOs, and these are group purchasing organizations. And all of the hospitals and health systems partner with one, potentially two, a primary and a secondary group purchasing organization, which really is the entity that works with the manufacturers, distributors, helps negotiate price, and gets the product from manufacturer distributor to the hospital and health system. And they really help they help our hospitals negotiate those prices on their behalf, as well as work with the manufacturers. And so when we're talking from a hospital and healthcare and integrated healthcare perspective, our healthcare system perspective, we're working with the GPOs, but that's really just at the hospital and health system level. All of those other provider types that I mentioned aren't traditionally part of GPOs, yet they now have a significant need of PPE. And when we have a baseline PPE supplied through GPOs to the healthcare systems, and then that gets kind of exhausted, there isn't an additional level of manufacturing that has been necessary to backfill the needs of all of these other provider types, which is where we've seen a significant challenge. The report does go into more detail on the supply chain in terms of how GPOs work and leverage those relationships and resources between manufacturers and healthcare providers. You see here the manufacturers make PPE, can sell it to a supply chain wholesaler or distributor, and then that's where the GPOs come in to really help negotiate those prices and get the product from the manufacturer to the healthcare providers. So while we discuss the options for retooling, certainly a very beneficial way to partner in the healthcare industry is to partner with some of the existing large GPOs that are across the country. The report does go into kind of PPE demand forecasting considerations, and we did a demand analysis, which was challenging for the reasons that I've mentioned earlier, in the sense that for N95s, I'll take as an example, those aren't something that are traditionally used by every healthcare provider pre-COVID-19 in every healthcare setting. So the demand numbers, we surveyed our members, and we got demand numbers and their usage numbers for 2019 to try to estimate what a baseline percentage would be needed for COVID-19 response and going forward. And when you look at those 2019 numbers, the number of N95s that are used is relatively low compared to what we need now, because they weren't traditionally used in every setting of the healthcare industry. Whereas if you look at gloves are used by everyone every day, and that demand stayed relatively consistent because gloves are just commonly used materials in the healthcare setting. So we did see a bit of the fluctuation in terms of the demand for some products has stayed the same and the demand for others has increased. But other things to consider from the healthcare perspective is that we are a very heavily regulated industry. So not just talking about PPE, but overall as an industry. And our hospitals and healthcare partners really do follow CDC's guidelines and recommendations for what is the appropriate use of PPE and what PPE needs to be used in different settings. On top of that, we are then regulated, or our PPE is regulated traditionally, depending on the type, by the FDA, CDC, and NIOSH. So when we look from a healthcare industry, when we look at PPE, we are making sure it is approved and it is a recommended use by the CDC, and then also approved by any of the regulatory bodies that require us to use approved PPE. So that makes it a lot more challenging. The regulatory process from the manufacturer side, we know, is cumbersome to submit all of your 510Ks and get them approved. And it makes it a little bit of a lengthier process in terms of just retooling to manufacture PPE and getting it from point A to point B when you have to add that regulatory body in there. The regulations of that, though, is that if the regulations change, so if a new product comes to market in 3 years that is better than an N95 and the CDC now requires that product, our healthcare industry is going to have to transition to that product. And so that's one of the considerations that we put in the report, is to just, from an industry perspective, is to really understand what the current recommendations are from CDC and what new products are coming to market that then might become the kind of the requirement. Facility differences I talked about, you know, your small independent mom and pop home health agency is not going to need nearly as much as your integrated health system like a Centera or an Inova. And then masking mandates. So as long as masking mandates are in place, we will see the continued increase in PPE from the general public's perspective. So that doesn't necessarily need to be the heavily regulated healthcare PPE. It's such as surgical masks. I have one right here, which is not a regulated. This one is not an approved, you know, level 3 mask for healthcare, but it is just one that has been retooled and manufactured, and majority of the public are using. We also look at the cancellation of elective procedures, which you all probably heard about early on in the pandemic, which we did as an industry for a couple of reasons. One, we thought we needed to save capacity. We saw what was going on in Italy. We saw what was going on in New York at the time. And we said, oh my gosh, we're going to have people at our doors and we're not going to be able to care for them. So we needed to open up capacity, but also because we were facing a supply chain shortage, and we needed to ensure that when we did see that surge, and if we saw that surge, we were conserving as much PPE as possible to be able to protect our workers, to care for the patients. And then the other thing is the COVID-19 vaccination efforts, so which are currently underway, as you all I'm sure are aware. And one thing that we really want to note is we didn't know what type of impact that would have on the expectations to wear PPE in the healthcare workplace. So if a healthcare worker gets a COVID-19 vaccine, will they still be required to wear the elevated levels of PPE that the CDC recommends? And the short answer is yes. The vaccination efforts are just one tool in the toolbox in terms of the fight against COVID-19, and it's not the saving grace that is going to help everybody and kind of end the pandemic. And so in talking with a lot of our senior leadership at our hospitals and health systems, the PPE protocols that are in place are going to continue to be in place, even if their employees have been vaccinated with COVID-19 vaccine. And then I mentioned the regulation. So the regulation aspect through FDA's 510K and NIOSH approvals, depending on the level of PPE you're producing, or the new regulations that come about or new products that come to market is a consideration and a challenge when you're considering retooling. So Dean, that's all I had, is just an overview. I know I sent Cheryl, I think this morning, the final report. I don't know, that is more than welcome to share that with the group and widely. It's final, and I'm happy to answer any questions as it relates to this.
Thank you, Kelly. Yeah, and that report is now posted on our website at the link that's in the materials that I have above as well. So if you go to our website and look for the program page, you'll be able to find the full report and get all the detail behind Kelly's great points. So, I don't know if we have any, I don't see any questions in the chat. If you've got a question, if you want to throw it in the chat, and we can keep moving on and we'll address them as we go. So if you think of something as we go, if you want to throw it in the chat, we will come back to it at the end of the presentation. I'd like to introduce Brett next. Brett Vassey, who's the president of the Virginia Manufacturers Association. We knew when we started on a process to help manufacturers retool, we needed to work closely with Brett and his organization, because they do a great job supporting the manufacturers in the Commonwealth. They also have a lot of insight into capabilities and potential opportunities. So we had engaged with Brett from the beginning as we put together the program, and they've been instrumental in helping us figure out where we need to go and how we need to help. So Brett, I'll turn it over to you if you want to take the next section.
Great. Thanks, Dean, and thanks to GENEDGE for putting this collaboration together. Absolutely critical, and the right timing as well. So our role, we play a couple of roles in this program. Number one, we have a very specific role, which I'll go through right now, on PPE and critical industry workforce development requirements and regional capacity. We have a second role, which is helping to identify multiple tiers of supply chain within that PPE category. It's more than, for us, it's more than just masks or gowns has been outlined. That's the final product. there are literally hundreds of suppliers that are manufacturers that go into fabricating that particular product, and that is part of a critical pathway to manufacturing the final product to get into the supply chain. We've also had some experience working with the Department of Emergency Management Services since March in helping to source PPE, both donations and then stand up manufacturing capacity. And we have assisted over 20 companies just this year to convert to PPE production. And I think our first 4 or 5 are participants in this program, which is exciting to be able to see that assistance. So I'm going to give some insight into what we've learned over the last 8 months about the public procurement and the healthcare procurement that continues to confound manufacturing capacity. And those are things that we'll bring into this conversation to hopefully resolve over the next year as well. So let me move on to the next slide. This is the timeline for our deliverable to the project around the workforce side, focusing on the complete critical industry and PPE identification. And I've got a short list I'll show you. It's pretty daunting, the number of products that support just the 4 or 5 principal PPE products that the public system is looking at. Of course, being able to convince companies to convert operations or expand operations or relocate to the state, as this project contemplates, to either manufacture a product in the critical industry or PPE specifically. You have to be competitive, and that relies on a number of things, but workforce is the big one. So what we're doing is an assessment of the workforce system in the state around the high demand occupations that specifically have industry credentials and industry skill sets that have already been mapped and identified that fill in for those PPE manufacturers. That's a pretty daunting exercise. We're just about finished with the first phase of the report, which we intend on delivering tomorrow. But we have been able to do an identification of the high demand occupations that fill in under all of these PPE and critical industry infrastructure companies, map the skill sets to industry credentials, and then we've mapped those credentials out to the public education system, assessing where we currently have industry training going on, what the gap is between the actual supply and demand from the public and the private sector, and then where the gap is. And then finally is an assessment of capacity, both the capacity of the public education system, primarily the community college system in this case, to be able to meet those demands from the industry and train for those high demand industry occupational credentials, and we call those skills credentials. And so we have done most of that work, but again, we're going to deliver tomorrow our first report, and then by February we will be able to deliver our final report, which will include an assessment of trainer capacity, not only the training facilities, but the actual trainers themselves. Do we even have enough trainers? And that's going to be very helpful if we're going to be able to scale as a state to be a major player in either the supply chain to PPE or PPE production in and of itself. So this is just a very short list of PPE critical industry products that we know, and you're going to see this reflects very similarly to the VHHA report on those principal products that are needed. But then we also get into non-medical, which gets a little more specific. Then it gets into medical devices, which these are just the short list. I'm going to pause right here and say that we have already identified one company in Virginia that's in this project that invented a brand new sanitation device through a program we call Project Lightsheet in order to develop a cabinet using UVC that sanitizes everything from hand tools to stethoscopes to PPE N95 masks in less than 30 minutes. Really remarkable technology, all invented in Virginia, manufactured in Virginia, and now in the marketplace. after validation and testing as well, which is almost unheard of to get that level of testing. So that's one good example. And this program is going to help that company bring this across the finish line. And that's very exciting to have that already in the works. Down here in indoor air quality, we just put the IAQ category in here just for reference, because IAQ literally has a half a dozen technologies, from ionization technologies to HEPA technologies under it as well, that are important to the whole pandemic response. And then we get all the way down the supply chain to raw materials. And I thought Kelly's graphic where she showed the manufacturing to the hospital process and that chain of custody of those products is very important, because much of the supply chain problem that occurred earlier this year was not because there weren't necessarily enough manufacturers of PPE or even non-medical PPE. It was that literally the manufacturers of the raw materials didn't exist in the United States anymore. And that's a sad statement, but we've identified that, and it's a huge opportunity, particularly around non-woven materials that we had to import, and we still have to import, but we think that there's a huge opportunity for Virginia in that. And then you even get down to things very simple. Folks forget that the plastics that are all dependent through this supply chain, everything from medical tubing all the way up to housing for ventilator systems, starts with natural gas. If we don't have enough natural gas, we can't make any of it. It's all built around natural gas. So this whole supply chain is a picture that we want to paint for folks, and it gives a much broader opportunity for companies, for the Commonwealth, for industry training, and for workforce development. And it's exciting. Despite the pandemic, it is exciting. And then finally, what we're bringing to the table is the full circle of conversation around PPE. Is once you get through the primary demands, you get into the non-medical, you get through the devices, you get into raw materials. What do you do with all of it whenever you've used it? Nobody's thought about that, and that's what we're bringing into our report. We have to have a way to recover it, recycle it, and bring it back into the supply chain as a raw material. And we think we can do that through advanced molecular recycling. And there is a facility, one facility being constructed right now in Virginia that could have the potential to keep all of that out of landfills and back into the supply chain. So this is exciting if we can get all of this picture together, paint this for communities, and help them really recruit and develop talent, develop companies, and grow. So we want to give you an idea of just some of the high demand occupations. We've done some of this work before. This gives you a smattering of occupations that are all currently still essential to these industries. When we look at how we're going to present a very complicated picture of which industries, which occupations, and what credentials they need and where they're provided, we're going to do it through a matrix. So the VMA, we have produced this matrix internally for our own workforce organization called the Manufacturing Skills Institute for almost a decade. And it gives a nice breakdown of the type of readiness needed, the type of credential needed. It's mapped to an occupation, and then it gives you some information about where it's at, what skills it measures for, and we'll have all that capacity information there as well. So trying to make literally 400 or 500 pages of various documents into one matrix that's readable and understandable, and people can know how to fast react in a public policy environment, which is really what we're trying to affect here with this program. And then being able to measure, this is the part that's a little easier, measuring. Once you get this done, you understand what's needed based upon the industry and the occupations, then you're able to assess the schools themselves. And that's a pretty straightforward process. We've already done this once in 19, both at the community college level and higher ed centers. So we're going to be able to produce a very granular report that will show each of the credentials by community college, enrolled, completed, and industry credentials attained. and be able to show a picture of just how ready are we for growth and support in this space. And then finally, when we talk about growth and support, we oftentimes forget, do we really have the capacity at the public education systems that will provide this training? And we have done this work before as well, in setting classroom assessments and setting laboratory space assessments by community college and higher ed center to say who currently is at capacity and where is their additional capacity. So again, you know whether or not your community college is going to need to set up temporary facilities, or they're going to have to bring in alternative online training. Can they physically handle the on-site presence? And of course, COVID has changed on-site as well. So that being said, you know, our assessment scorecard is really what we're going to call it. That'll be delivered in 2 phases. Again, we're going to have one part of the report tomorrow, and then the final report will actually be February of 21. I'm pinch hitting for Dr. Victor Gray, who is the lead for the VMA and our affiliate, the Manufacturing Skills Institute. He will be back in this project the next time we present. So I said there were 2 parts of our role. One is this very important workforce assessment, workforce component role, but it really starts with this critical industry and PPE identification. So I want to share with you a much larger list to give you an idea of just the gravity of, just the totality of opportunity. Bear with me just a minute. Okay, you should, yeah, there we go. So this is what we have been building in our research over the last couple of months, both at the state level and at the national level, with our affiliate organizations at the American Chemistry Council and at the National Association of Manufacturers. And we're trying to itemize and categorize PPE and PPE components to give you an idea about the totality of opportunities. So we've gone through and identified some of the challenges that have been in existence since March, some more acute earlier in the pandemic, but everything from electrical equipment to, as I said, the IAQ category, which is incredibly important, machinery manufacturing, and then you can get down into, we had heard about PAPR and those different components that go into that. There has been chronic issues there, recycling, as we've talked about. Believe it or not, in the pulse oximeters, battery production has been a challenge. In the raw material side, we've continued to see some challenges in alcohol production, not hydrogen peroxide so much now, but in alcohol and polycarbonate and polypropylene products. And then you get down into even sanitation chemicals. Believe it or not, some of the disinfectants on the EPA list are still a challenge, very few producers. And then you get down into critical industries, which we have also identified, and that is under the CIC, the the Homeland Security under the Cybersecurity and Infrastructure Security Agency. There are some key industry sectors that are important for us not to forget in this overall discussion, and that being chemical, defense, energy, food, nuclear, and those are a few just that are on our short list. And then finally, to give you an idea of just the industry categories that we've already identified, and we like to use the standard industrial classifications in order to classify all of this so that it's easier to understand. So we've taken all of this work, cross-referenced it against the SIC major groups, and then we've put in their descriptions and their details. And these are the major groups that all of this work falls under. It falls under really categories 22 to 38. So we think in terms of 22 through 51. And so we're going to be taking this chart, putting it in a little easier to understand format, just like we're taking the very complicated world of workforce training into that matrix. And we really think that a visual communication of these are the industries and opportunities, these are the workforce training needs and opportunities, and here are the gaps. That picture is what we want to paint by February. So we'll have our first out tomorrow. Dean, the next thing I'll say that we've identified, and this isn't necessarily part of our responsibility in the project, but it's what we want to contribute as being part of the Commonwealth and being part of the Operation Warp Speed and part of the Department of Emergency Management and Services overarching coalition to make sure Virginia is prepared. There are a couple of things that we identified through this that absolutely have to change for manufacturers to be able to respond to this, no matter what we identify. Number one, there still is no consistent demand signal from the public procurement system. When you ask what over the next 6 months, even 6 months ago, what is the demand for hand sanitizer? What types of volumes do you need? What containers do you need them in? How often do you need them shipped? No one could answer that question. It was answered in 30 to 40 different procurement centers. Manufacturers generally, if you want small domestic manufacturers and medium to shift production, they're not going to do it on a hope and a prayer. They need a clear demand signal, and the state's yet been able to present that. So that's an opportunity for the state to get its act together, quite frankly, around aggregating the demand under some major categories, sending out some demand signals. And I think what Kelly has outlined that they've done through their own hospitals and their own members, that's exactly what the state has to be able to do. Second thing that we've identified, which should actually alarm folks, and it's got us concerned enough that our organization has asked for legislation to be introduced to correct it. The state is procuring PPE right now from foreign sources, and they're not requiring any testing or validation of the products coming into this market. We've taken apart some of those products. For instance, 3-ply masks. The second ply was tissue paper. It would have never passed any FDA certification. So we know that what has to happen, because the state procurement system and many that follow it, they go by low bid only for PPE, believe it or not. We talk about it as critical infrastructure, but we don't allow it to be purchased in that way. We force it to be bought under low bid. So what that's doing is, without a requirement of a US-based testing and validation of that PPE, we're allowing foreign sources to cheat, get into the market, beat domestics, and it's an inferior product that probably is not protecting people. So we think that that's a critical, fundamental change the state's going to have to make, and the organizations that work with the state is going to have to make, if we're going to have more domestic supply of PPE and more domestic critical industry infrastructure manufacturers that are successful for the long term. Because really what we want to do is never have to repeat second and third quarter of this year, where we had a lack of everything from gowns and masks to toilet paper and paper products in the grocery stores. That just shouldn't happen. And we think we can do that. And then finally, what we've also become aware of is pandemic stress procurement systems, even in manufacturing. We get that. But what we did notice is that there's no consistency in the public procurement system itself. So for instance, not knowing what your demand is creates a system where there's hoarding. And we found that to be true in a couple of areas that we were working, particularly in hand sanitizer production. We found that many of the public procurement systems were, when we asked, well, what is the demand for what you're short over the next week, 2 weeks, 1 month, 6 months? And their answer was, we just fill our storage room as often as we can. So that creates some imbalances in the system too, because as Kelly very appropriately noticed, the major players are the group purchasing organizations and the distributors. and they control the price. We just have some limitations on production, but they're controlling the price, and oftentimes that signal gets confused and folks hoard product. And then that creates that scarcity all the way back the supply chain. So we think we've learned a lot. We think we can fix a lot of this with good communication and much better data analytics and supply chain signals and demand signals. And that's all possible through this project. So Dean, I want to thank you. You got your work cut out for you. Cheryl, good luck as well. And we just are so looking forward to working with you. We think it's a great project.
Thank you, Brad. I appreciate that very much. And I think, Cheryl does have a lot of work cut out for her, doesn't she? I'm going to turn it over to her to actually talk a little bit about the next steps and how we're going to go about doing that. But your concerns, I think, are valid, right? I mean, we've had the same kinds of conversations with all of the companies that we're engaged with. And really, she's going to talk a little bit about how the process works that we go through. And that first part of the process is really a conversation about understanding the kinds of things you're talking about and how you actually build a plan to address them. So without much further ado, I'm going to introduce Cheryl in the interest of time and let her talk a little bit about the program and how it works. Cheryl joined us. She has a wealth of experience in managing these types of programs, as well as commercialization efforts. She has a BS in chemical engineering from Virginia Tech, go Hokies, the Master's of Engineering from NC State, and her MBA from King University. And then she's got her doctorate in engineering, again, from Virginia Tech, again, go Hokies. So she's a certified PMP and a professional engineer, and she brings a wealth of experience, and we've been very lucky to have her. And so she's really kind of helping to herd the cats and get things moving forward for us. So Cheryl, I'll turn it over to you. You can talk about what the next steps are. And then I'll, hopefully if we've got anybody questions, you please stick them in the chat box and we'll try to address as many as we can before we run out of time.
Great, thanks, Dean. And thanks to Kelly and Brett for their presentations. I think it really helps for folks to hear their perspectives and what's going on, to help companies think about whether they're potentially interested in this program or if this program may be a good match for them. I'm going to talk more about just some of the logistics of this specific grant program. Dean introduced it at the beginning of the webinar, and I'm going to get into the nuts and bolts of it, if you will. So that because it's primarily state funding grant, we've got a process that we go through with each company that applies or considers applying, and we're consistent across that process. And this graphic, hope you can see my screen share. But the program Next Steps begins really with people applying to the program. So if companies are pivoting towards PPE items or have pivoted into PPE, items that were mentioned by Kelly or even items mentioned by Brett, please go onto the website and apply. If you're not sure if you're a good fit, it's still okay to apply. It's about a 5-minute application process. And what that does is it triggers us to contact you and the other folks at your company. And we have a conversation to give you some more background information on the program to see if it may be a good fit. If it does appear to be a good fit and seem to make sense, then we have a commercialization readiness assessment with each company. This is about a 2-hour-long meeting. It's no cost to the companies. The companies that have gone through it have actually said it's beneficial because it's helping them think about the product that they're moving into or pivoting into. For some companies, it's been a brand new product. For other companies, they're adding on. For instance, they're going from surgical masks to N95, or perhaps they make some kind of a raw material and they're thinking of moving into the end products. This assessment just starts the conversation to see where each company is in terms of commercializing that product, help us to understand where there may be some gaps in what they're doing so far, where they may be struggling, where they may be looking for help from a company such as GENEDGE in this program. We then take the information from this readiness assessment and we present it to our advisory committee. Dean had mentioned that there's an advisory committee associated with this grant. That's actually the group of people that have the authority to approve companies into this program. The advisory committee meets once a month on the third Monday of each month. So depending on when companies apply, unless it's the week before the meeting, we endeavor to get every company that applies into this quickest round of the advisory committee meetings as we can. So we try to work to the company's schedule to make sure that that happens. To date, we've had 13 companies approved into the program. So it's about half of the 25 companies that we think will be able to put into this phase 1 PPE program. The companies that are in the program have a variety of PPE that they're manufacturing. I think Brett mentioned that we have one that has a UVC product that helps to kill the virus. We have people that are making surgical masks at different levels. Some of them are working to get their masks approved so that they are technically surgical masks. Others are making masks that someone like us can just go out and buy and use. We have folks working on N95 masks, people working on sanitizers, also personal protective barriers. So when you think about different things for businesses or schools that may help to separate us, there's companies working on that, which can help with the social distancing requirements, the other PPE that people are wearing. So we do have a variety of commodities and finished products that people are working on. So if you think your product, or if you think, for the economic development folks on this webinar, if you know of a company that you think may fit into the program, please contact us. We'll have the conversation and see. We would rather people contact us if they're not sure than to assume that they may not fit in. So think broadly when you think PPE, and to Brett's point, think supply chain as well. Think through the entire supply chain when it comes to manufacturing PPE. You do not have to be the in-good manufacturer of that PPE to qualify for this program. Having said all of that, we then, if the advisory committee approves companies, then we work with them on a proposal. There is a 90-10 split for this grant. The 10% to the companies just helps to make sure, to use an expression, they have skin in the game and that they're serious about what they're trying to do, because, you know, the Go Virginia funding is looking for companies that are in this for the long haul, for sustained PPE manufacturing over the next several years. And then we start working with the clients. And what that looks like is the first phase for accepted companies. All the companies are going through a commercialization business plan with us. Different companies are at different points of that process. Some companies are already selling some products, but they maybe haven't done all the testing. And I'll go back to the idea of surgical masks for that example. Other companies have prototyped a product. Some companies are still working to do that. There's a variety of areas where companies are looking for assistance. It may be helping to understand the marketplace, helping to understand who the purchasers are. Is it the group purchasing organizations through VHHA system or the hospital systems? Is it industry? We can help companies think through that and who they are. We can help companies think through their risks, make sure that we help them minimize any of those risks. So again, that they're successful and they meet their targets. What the whole value chain is, we help them think through the entire value chain, the different items within each value chain, the human resources, the technology, the equipment, where there may be gaps. So that's what we do in the phase 1 portion of this program. That in itself is a product. That in itself is a commercialization business plan that every company will get. The other thing that business plan does for us is it helps us and the companies identify these potential shortfalls or areas where they may need assistance. They may need assistance understanding FDA requirements or EPA requirements, and we can help with that. But as we identify those needs, we put those into what we're calling phase 2. And phase 2 is a separate contract with each company that is tailored specifically based on the outcomes of this business plan to help each company be successful. You know, again, some companies really have a strong marketing staff, other companies don't. Some have all the technology in place. Others need to expand or grow their technology. So it's definitely a tailored process as we move into this with each of the 25 companies. And then the output of phase 2 is a combination of the resources that GenEdge helps provide, and I'll show that on the next screen, and what the companies have committed to. They may be committing to hiring people or going from 1 production line to 2 production lines through this process. So GenEdge provides resources for this. One thing we don't provide is capital, right? So this grant is not geared to buy equipment for companies. Go Virginia is sponsoring it. They're very interested in promoting good jobs throughout the Commonwealth and increasing the employment throughout the Commonwealth. What GenEdge is wanting to do is help companies be successful for that to happen. But we recognize for smaller companies, they may need assistance in areas such as business planning, understanding what testing needs to happen, understanding where test houses are that are certified to ensure that their products meet all the requirements. Again, to both Kelly and Brett's point, that we're not just throwing products out on the marketplace that wouldn't pass a test. There's enough of that floating around. We want to minimize that. We want to be able to label the products and guarantee people what they're buying is what they think it is. We can help with risk management, supplier scouting sources. Again, a company may say, gosh, I've got this great idea for these barriers. I've had 3 or 4 people or locations want to buy them, but they don't really understand what the market looks like or how to get into it. That's right up GenEdge's alley to help them as a resource through this grant. And again, if you think you have unique items or situations, please email and contact us or ask in the chat. We'll answer as many questions as we can to see if we can align up what you think you might need with the resources we can provide under this grant. And those are the only slides I have. Again, that's just the logistics and the nuts and bolts of this program. Dean, I'll turn it back to you in case there's any questions in the chat.
Thanks, Cheryl. And like I said, Cheryl is kind of the first place to go if you've got questions about how things work. And to her point, we have to make sure we're thinking not just about people that make masks, but there's all of the other elements that Brett talked about that are part of the supply chain. And we've got folks that are kind of spread throughout that supply chain already in the program, and we'd like to continue to expand that. So if anybody has any questions, I don't see any questions specifically. The only question Brett had asked if we could post the link. So I posted that in the chat, the link to our webpage where you can find Kelly's more detailed report. And once we receive Brett's report, we'll post that there as well. So that link is a good link to maintain. Bookmark that and continue to visit it. If you want to know more, as we learn more, we'll continue to put information there to disseminate it. So I'll open it up to the floor. If anyone has any questions, either put them in the chat or put them, or feel free to unmute and ask. Monterey asks, are there opportunities for new businesses? Cheryl, would you like to take that one?
Sure. The short answer is yes. When if you apply and we talk with you, if it's a new business, you're thinking of starting a business, that may be too early in the process, but there are companies applying that are within a year of being a company. And there's one company that's applied that they spun off an LLC to add on PPE to the current small business that they have. I will say that we're not necessarily working with people to help them define what that business can be. That's something you would have to bring to us, that you've started a business, it's for this kind of PPE.
Excellent. Are there other questions? Well, hearing none, and I know that we are a little bit over time, so I appreciate everyone's participation today. Thank you all for joining us. Thank you to Kelly, Brett, and Cheryl for doing such a great job of explaining your different areas and providing some great information.
We have
We are recording this, as I said. Oh, sorry. Go ahead.
there was one extra question out. If there's no capital, what's the 90-10 split? So the resources that we talked about all cost money, and some of them are through third-party providers. So that's where the 90-10 split comes in. And again, feel free to contact me separate and I can go into more detail.
Thank you, Cheryl, for catching me. Yep. I appreciate everyone participating today. I appreciate Kelly, Brett, and Cheryl for doing such a great job. Hopefully everyone has a very Merry Christmas and a happy holiday. We are continuing to take applications. So Cheryl said the best thing to do, visit the page, join us, put your application in. If you're not sure, go ahead and put the application in and we'll have a conversation and see where we're at and what makes sense to move forward. But we're trying to get to that 25 companies and be able to build out enough capacity within the state, as Brett said, that we don't end up living through what we've lived through before. So hopefully we can have that kind of positive impact of working together. So thank you all for joining us. I'm going to turn off the recording and we will be posting this on our website. I will send out a follow-up email after this as well with the presentations, links back to the page where you can find the reports, links to where you can see the recording as well. So no other questions. Thank you very much for joining. Appreciate it very much and look forward to seeing you all through the new year. Have a great day.